Welcome to People's Daily Talk. Right now, we're at the Beijing office of Gates Foundation. And joining us for today's discussion is Mr. Mark Suzman, Chief Strategy Officer and also the President of Global Policy and Advocacy of the Bill and Melinda Gates Foundation. Welcome to the talk.
Thank you so much.
Well, so first of all, would you like to tell us what do you do at the Gates Foundation?
Yes, so I have two roles. The first role as the President of Global Policy and Advocacy is I oversee all of our relations with key governments, with multilateral partners like the United Nations Agency, and with philanthropists and other external partners who we need to help achieve the goals we work on. And as Chief Strategy Officer, I also work directly with Bill and Melinda Gates and our senior leadership to try to decide what are the most impactful investments and uses of our voice against our overall objective, which is essentially to try and help the poorest and neediest people on the planet.
And so what drove you here then?
Well, I think a desire to have impact for poor people. I come from South Africa originally, which is a country that has a deep historical divide between rich and poor and black and white. And although I worked as a journalist and at the United Nations before, at the United Nations I learned the importance of goal setting and measurement. And so now in the third chapter of my career at the Gates Foundation, I've been part of how do you actually build those coalitions for action, that actually these challenges of dealing with poverty, with ill health, are actually ones that we can tackle. So you don't just say wonderful things about it, that you need to have what concretely are you putting in place? What are the resources? What are the policies? What's the scientific research around the intervention? But each of them become very concrete. The Gates Foundation was a unique opportunity to try and act as an implementer, to be part of projects and programs that actually help people on the ground. So the core mission of the Gates Foundation is that every person deserves the chance to a healthy and productive life. And that is what drives everything we do at the foundation, and it resonates very strongly with me personally.
Right. And I heard that the Gates Foundation has just released its annual Goalkeeper Report. So could you tell us what that's about?
Absolutely. So this is now the third year we've launched a report. It's linked to the UN Sustainable Development Goals. Those are the goals that came after the Millennium Development Goals and for between 2015 and 2030. What we've been trying to do through these reports is A, show you that progress is possible. The world doesn't understand that that's probably the best and most important story that's happened, that global poverty is halved over a 25-year period. So can we, as the Gates Foundation, use our brand and our focus on data to have a report every year which does a balance of both trying to highlight the good news, but then we also try and shine a spotlight on a particular challenge every year that might be holding progress back. So this year's report, and I have a copy here right here today, is focused on global inequality. And so it has two messages, and I'm very happy to give you your copy.
Yes.
One message we have, which is based on new data that basically tracks district-level progress across nearly all the developing world. And it says over the past 20 years, over 99% of all districts have seen progress in the key indicators of child mortality and in education, years of education. That's progress happening everywhere, even in the poorest, most miserable parts of the planet. That, we regard ourselves at the Gates Foundation as pretty optimistic about what can be done, and even I was not expecting that. But then the second set of messages shows that actually that progress is at severe risk because of three big forms of inequality. Global inequality between rich and poorer countries, but then more interestingly, regional inequality within a single country. So in Nigeria, for example, a child is 5 to 6 times more likely to die of a preventable disease if they are born in the north of the country than in the south of the country.
Wow.
There are just these massive discrepancies. And so those regional inequalities are a big challenge if we're going to meet the Sustainable Development Goals. And last but not least, there is also household level inequality, which is basically gender inequality. That within the household, you still, in most places, don't get the same resources going to women and girls in the household as go to men and boys. If you take just simply the example of agricultural development, that we know that in poor rural societies in Africa and South Asia, women are roughly half the labor on the land, but they also are likely to have access to smaller plots of land. They're less likely to get financial credit. And so unless you take a very deliberate focus on addressing the needs of women farmers, we simply cannot meet the goals we have on agricultural productivity and poverty reduction. But there again, China actually has a relatively good model in terms of the strong improvements in agricultural productivity and smallholder productivity, including for women farmers, that we hope could be a model for other countries.
Right. So from all those cases and the researchers displayed in this report, do you have any suggestions on addressing those global inequality issue?
Yeah, well, again, China has some good examples, and I don't want to suggest that China has solved all of these problems, but if you take basic examples we're looking at, like, there's no more dramatic inequality than being alive or being dead of a preventable cause. And if you take something like maternal mortality, only 30 years ago, in rural China, you were twice as likely to die in childbirth as in urban China. 30 years later, that gap has now completely gone away. And that is because of disciplined policies put in place by the government, by health services, by training of providers and community health workers with pregnant women. Those are models. They're not deeply expensive. It doesn't require dramatic new technology. These can be rolled out pretty well everywhere across the world right now. We know how to do those very basic interventions. Now, for the next level, we still need very important tools and research. So there's a big part of the report that also talks about the need for more investment in innovation. So another example would be malaria, which is a terrible disease which still kills, especially in Africa, hundreds of thousands of children every year. Now, China, as recently as 50 years ago, had 30 million cases of malaria. Again, over the last 2 years, there have been 0 cases of domestic malaria. If that happens for one more year, which we expect it will, China will be declared by the World Health Organization to be malaria-free. Now, that is an example of strong domestic prevention and treatment. Now, that's more challenging to do in some parts of Africa and Asia, which have much tougher tropical environments in which mosquitoes can breed more easily. And so we still need more research into different kinds of bed nets, into a malaria vaccine. But the basic steps, again, of a systematic government effort that looks at prevention and treatment and then just measures it, holds communities accountable, these are models that can work everywhere in the same country with the same resources. So it's not just simply a question of, oh, well, you can do this in the United States, but you can't do this in a poor country in Africa. Okay, no, we have examples in poor countries in Africa and Asia where there are districts that have very successful outcomes, but they're very unevenly spread even within those countries. And that can and should be tackled right now.
Well, 2019 marks the 70th anniversary of the founding of People's Republic of China. So I'm wondering, what is your view of China's record in addressing the issue of inequality?
I think China's improvements have been among the most dramatic of any country in the world. The absolute number of people benefiting has been truly spectacular. So whether it's on poverty reduction, where nearly 800 million people have been pulled out of extreme poverty over that period, over a 30-year period in this case, but whether it's the child mortality numbers, the maternal mortality, education, I think China has a lot to be very proud of over that period. As I said, there are still gaps and issues to learn on, and that's why we still do work in China on pressing issues like, for example, tuberculosis. We find very receptive local partners at the provincial and at the national level to work with us and try and tackle those. And tuberculosis is another example where the lessons we've been learning here about how to deal with treatment, including in this case some of the drug-resistant treatment in tuberculosis, are models that we then now start to take to other countries. So I think that, we hope, is one of the lessons of both what China has done domestically, but the kind of partnership that we have with the government of China that we can help take to other countries.
Well, thank you for the sharing, and I hope everyone can learn a lot from this report and also take more actions to address the global inequality issue and achieve the sustainable development goals.
Great.
Thank
well,
you.
thank you so much for having me.